So once you've hopefully assessed the patient and diagnosed the cause of colic, you can begin treatment. Mild colic, sometimes it just resolves with some hand walking and some time. If you have flunixin, meglumine, or banamine, that's usually enough. I've even had clients who, if they have that on hand, they may start this. I always prefer they call me first and say their horse is potentially colicking. And if they have some banamine on board, they can give it. They often, if they're not comfortable doing IV injection, which I don't usually encourage, they can give it orally. And then they can walk the horse. And usually after about 10 to 30 minutes, the horse will improve. They'll call me back and tell them everything is good. If they don't see improvement within an hour, if the horse continually gets worse, acts more painful, then I definitely need to go see that animal. If it's some kind of impaction colic, so I think there's ingesta, backup, feed, etc., pain meds again, so the flunixin. I also often will give something along the lines of buscopan. That can help to reduce spasms in the GI tract. So if it's a gas colic, especially, buscopan can help to relieve those spasms. Fluids, so ideally orally. So I will give warm water. If it's a very serious impaction, you do want to hospitalize and give IV as well, because then both oral and IV will really help to rehydrate the impaction. Some impactions can work through on their own, but really severe ones do need hospitalization fluid therapy. DSS or mineral oil. Mineral oil is something people say it's a laxative. It doesn't really have a laxative effect. More than anything, it kind of greases up the poop, which may help it slide a little bit more, but it also lets you know that things are moving. You're better off actually with Epsom salts, for example. That helps to draw fluid into the intestine. So if you team up Epsom salts with IV fluids, a lot of that fluid will draw into the intestine and help to soften up the impaction. And then hand walking, getting the horse moving. Grazing, hand walking naturally helps to stimulate GI motility, and often that's what's shutting down. So severe colic, this means the animal most likely needs to go somewhere for further workup and surgery. There's a variety of factors, but things to think about: a high heart rate, especially over 70. I start getting nervous with a heart rate over 60, but definitely over 70, unresponsive to pain meds, or they start to do what I call breaking through. If I sedate that horse and put banamine on board, I expect that horse to be comfortable for a few hours. And if within an hour they start showing pain signs, I know there's a good chance that their colic is severe and that there's something more serious going on than I can potentially handle on the farm. Abnormal rectal temperature. So horses that are having a normal day-to-day colic should not have a fever, okay? There are some infectious diseases. We'll talk about Potomac horse fever. That's a little bit different. But really, there should not be an abnormal rectal temperature with a colic. The other thing is also if you feel any abnormalities on rectal palpation, for example, you can sometimes, you can usually palpate colon impaction. That doesn't necessarily mean surgery, but you can also, if it starts changing in size, say you come and detect the horse a few hours later, it's getting bigger. Also, if you feel straight ahead of you, but imagine extending you're rectaling a horse and your arm straight ahead of you, and it feels like stacked bike tires, okay? That suggests twisting of the small intestine. That often requires surgery. That means you're having intestinal torsion issues, and they should have surgery. Also, if you have an ultrasound, you can sometimes determine if there's a lack of motility, especially in the small intestine, and if there's a lot of reflux. Often that makes me want to send a horse to a referral facility as well, because either they have a very severe enteritis that isn't allowing ingesta to pass, or there is a twist somewhere, and that's what's causing things to back up. So, how do you prevent colic? Avoiding fast changes in the diet. So just because a different kind of grain's on sale today, if you're changing grain, you need to do it slowly over usually a 2-week period, just like we tell our small animal clients. Feeding good hay and avoiding lots of grain. People want to give a lot of grain to really beef up their animals, but unfortunately that's not what they're designed to eat. They're designed to eat hay, and they're supposed to eat it pretty continuously. That's another problem we have, is if you just give them hay once a day, that may not be enough. They're used to being grazers. So, they also shouldn't be eating a lot of food at once. So some people I just want to take care of my horses once a day. I give them about 10 pounds of grain and a huge bale of hay. That's not really how they're designed to eat. They're supposed to, little and often. Maximize turnout. Again, they're designed to be moving. This also helps to reduce stress. Frequent small meals. Make sure the food's not contaminated, moldy, etc. Good monitoring, noticing when something's not right. So if you have a small problem, you might be able to fix it just there on the farm. And avoid medications unless necessary. A lot of medications can cause GI upset, and that can set you up for colic. So this is an example of pipe stream diarrhea, which could be caused by several different things. Maybe it's some kind of enteritis, colitis, also Potomac horse fever, and other things that we will be discussing. So sometimes we have impactions, other times you have overproduction of fecal material. So Potomac horse fever. This is an infectious disease. It's caused by Neorickettsia ristici. It lives in a trematode that affects snails, but there's a common misconception that horses eat the snails. So my horse isn't near water, they don't get snails. It's not the snails so much as caddis and mayflies then eat the snails. And the caddis flies or mayflies often get into the water, so that can be a big problem. Is they'll get into the water buckets or your water trough, and the horse will consume it that way. Clinical signs: depression, diarrhea, and that pipe stream diarrhea in the last image. Fever, so you will have a fever in this kind of case. They may even get toxemia, and they can also get laminitic. Potomac horse fever can present like a colic, or at least initially like a colic because of the diarrhea. But it is something that you have to do that full exam. You will have a fever, and you'll notice some other things are going on. Plus, if you're in more of a wet area, we don't have a lot of this in this area, though there are strange little pockets where I have, horses that are down more in a marshland, etc., where I have diagnosed Potomac horse fever. But the sepsis that they can get, this diarrhea, toxemia, can also cause them to founder or laminitis. Diagnosis is there is a blood test, PCR, and treatment is IV antibiotics and supportive care. You do have to be careful. Banamine or flunixin. I once had a horse who we treated for Potomac horse fever on the farm. The treatment was successful. They used antibiotics and flunixin meglumine to keep the fever down, to keep the horse comfortable. But then a little while later, the horse started showing other kinds of strange signs. It turned out that the horse got dehydrated during treatment, and flunixin is a little tough on the kidneys, and the horse ended up in acute renal failure. So the horse had to come in, and we did end up saving the horse, a lot of fluid therapy, etc. But you have to be careful because this can cause some serious dehydration, and that combined with antibiotics and pain medicine can cause other problems. Prevention, reducing marshy areas and pastures, and there is a Potomac horse fever vaccine. Always some variable efficacy, but if you're in an area where this is endemic, it's a good idea. Salmonella, so just like with other animals, it's fecal oral, highly contagious, and zoonotic. So if you have this is something that you need horses to be in isolation. You can get it, they can get it, so you need to be wearing proper PPE equipment when you're working with these animals. Also, it can be very messy. I think I've told all of you the story about me refluxing a horse that turns out to have salmonella, and that was the one I got the mouthful of reflux. Luckily, I didn't get salmonella, but I was holding my breath for a little while. Anyway, severe diarrhea, very foul smelling. They'll be colicky, acting painful. Again, this is a colic that's caused by a disease, so you have to make sure you figure that out. Depression, anorexia, and they'll have a neutropenia on blood work. So you have to be careful. Some animals can have a carrier state where they're carrying disease and possibly shedding it but not showing clinical signs. Diagnosis is a fecal culture, so you need a sample every 5 days. Treatment, hospitalization with isolation. The animal's going to need fluids. That's the biggest thing in order to keep them hydrated through this process. NSAIDs to help reduce any kind of fever, discomfort, etc., and antibiotics for secondary infections. So choke. Choke is a disease when food gets stuck in the horse's esophagus, so not kind of like human choke. It's common in older horses if they have poor diets. It also can help happen certain kind of feeds like beet pulp. Beet pulp is something that when it gets wet, it expands. You're supposed to soak beet pulp before you feed it to a horse, but if you don't soak it properly or don't soak it at all, it'll get into their esophagus and expand. Or bolting feed, that's when horses eat too quickly. So you need to try to slow them down, because all of a sudden they'll not chew their grain properly and it'll get stuck in their esophagus. Clinical signs is all of a sudden the horse will stop eating, they'll act anxious, and the biggest ticket is you will see feed stuff and saliva coming out of their nose. All of a sudden there's green digesta coming out from the nose, the horse is acting anxious, can't eat anymore. What you need to do is you do need to call a vet. Clients should not try to fix this on their own. They should not stick hoses in their horse's mouth. They should not try to pump fluid into the horse's mouth. There's a chance they'll injure something or cause aspiration, but the veterinarian can come and sedate the horse, which encourages the horse to then drop their head, and then you'll pass an NG tube. It will stop at wherever the choke is. Sometimes if it's soft enough, the NG tube can just push the choke into the stomach. Other times you have to sit there and flush it, repeatedly flush fluid, which is another reason you want the horse sedated and their head down, so what goes up will then come back out the tube. It also may come back out their nose on the other side, but you want their head down so they don't hopefully aspirate anything you're flushing. Afterwards, you can give you can give some Buscopan again. That is something that can help to relieve the smooth muscle of the esophagus. And also, interestingly enough, little note here, Buscopan and oxytocin can also help to soften the smooth muscle tightness and relieve the choke. You also need anti-inflammatories. Choke can be very irritating, so it can cause damage to the esophagus. So you'll have to afterwards feed soft diets, keep them on some anti-inflammatories. And depending on how serious the choke was, you may want to put the animal on antibiotics, or otherwise it needs to be closely monitored for aspiration pneumonia. If it's just a mild choke, flushes easily, I don't have a lot of fluid everywhere, I may just have the owner monitor for a few days, especially if they know how to take temperatures and are vigilant. But if I've been working on that choke for hours, I've had a choke take like 4 to 8 hours to resolve before that animal's definitely going on antibiotics. Prevention, frequent dental exams, prevent them from bolting their feed, and make sure they soak their beet pulp. Here's an image of that. So respiratory diseases, all kinds of good respiratory diseases. We'll be focusing on influenza, strangles, EHV1, or rhinopneumonitis, COPD, also known as HEAVs. There's also exercise-induced pulmonary hemorrhage. That's something you see a lot with like race horses, and laryngeal hemiplegia or roaring. So strangled is called by strep equi, which is a gram-positive cocci. It is transmitted through respiratory secretions, horse to horse. So it gets into the environment. One horse snots, another horse picks it up, or they snot on you and then you go and pet the other horse. Clinical signs, mucopurulent nasal discharge, fever, and abscesses of the submandibular lymph node. So around the throat latch area under lymph node, you may see large swellings. They may not burst into abscesses yet, but if you notice enlarged lymph nodes with these other charges, then you think strangles. Young horses can get the most severe disease, and if, depending on how it's treated or not treated properly, they can get what's called metastatic or bastard strangles. It can actually somewhat turn inward, look like they go away, and then come out later and be really severe. Diagnosis is culture or nasal swab. You need to let this disease run its course. You have to be very careful. You can, often they'll have a fever, so you can treat the fever with something like flunixin meglumine. Also, you actually want the swollen lymph nodes to abscess open. You do not want to put the animal on antibiotics until the abscesses has opened. If you start antibiotics before they've opened, it may cause them to again turn inward and become a bastard strangles, or they'll end up kind of having this metastatic carrying strangles. So you can hot pack the abscesses until they open, flush them with dilute iodine, and start antibiotics at that time. Prevention, there is a vaccine. It's an intranasal vaccine. Be careful when administering it, because if it gets on your hands and then you give an IM vaccine, you can cause neck abscesses. Quarantine and hygiene, highly infectious. If I go see a strangles case, I change and shower before I go anywhere. Not New York, but other states will actually put barns on shutdown or under quarantine if this happens. So definitely worth keeping it out of your barn. and you need to do isolation protocols, quarantine, hygiene protocols, etc.